My name is Phoebe Olhava. I'm a physician and I work with rapidtest.org. And when I say work, I want to be very clear. I'm a volunteer. I'm here with Sara Citrenbaum, and we are not here to sell you anything. We just want to let you know we're here to help you in whatever situation you're in to find out what is the best testing strategy for your camp. What we've been doing since the beginning of the pandemic, our organization was formed back in the spring with Dr. Michael Minna as the director. And what we have done is essentially put together strategies for schools, for workplaces, for people, any kind of community setting to figure out what is the best way to go about testing. So just to move forward here in the slides, let's see. Just a little bit, obviously you're here trying to think about COVID in children. As you know, 50% of transmission occurs from people who are not showing symptoms, and children are most often asymptomatic or mildly symptomatic. The issues with children obviously are they are not authorized to be vaccinated. So hopefully you will be having your staff members vaccinated, people over 16 who are at camp vaccinated, but you may hopefully be filling your camps with children under 16. And of course, with this SARS-CoV-2 particular virus, there's a 2 to 14 day incubation window. So frequent testing is important. Basically, to go over a little bit about the different kinds of tests, there's obviously the diagnostic tests, which we use for clinical disease management. And here is often where people turn to PCR because you're really trying to figure out exactly what's going on with your patient. Now, for screening testing, that's really a public health tool. And what we want to do is monitor disease so that we control the spread, and we pick up people who are not showing symptoms but could be infectious. And that's where we find that rapid antigen tests really do the perfect job, because they can pick up high viral load and allow for a rapid result and enable you to immediately isolate that one person who turns out positive and contact trace if needed, if they've been in a group setting. Surveillance testing does not give individual results. That's really what we use for a population level of test. So again, the rapid antigen tests, we really feel are the best tool for screening purposes. They're inexpensive. Right now, the Binax Now test, which has the FDA approval, goes for about $5 per test when purchased in bulk. They're simple, easy to use. They've been approved for at-home use, no doctor's order, no prescriptions, perfect to be done with the anterior nasal swab. You could self-administer the swab, and again, you get those results within 15 minutes. And the key here, again, is to look for people with high viral load to make sure that they're not spreading the virus to others. As you all, I'm sure, are aware, the CDC issued its guidance in saying that the best way to prevent COVID is to stop it from coming into camp in the first place. So that points to the issue of trying to test people before they arrive and on day of arrival. So you want to, again, get those results back as quickly as possible, and that's what the rapid antigen tests can do for you. You'll also want to continue doing screening surveillance over the course of the summer, particularly for any unvaccinated staff and campers, to make sure that you can identify asymptomatic cases. Of course, the CDC says camps should establish partnerships with community providers who offer testing. Now, I know where most of your camps may be is in the very far backwoods, so it may be hard to find a vendor who will come to your camp to partner with local labs. Sending things off may be difficult. It's a lot easier just to have the test in hand and move forward. So what we can offer to you is helping you establish your own testing program. We have a playbook. I'm sorry, it's rapidtest.org here. I could change it. Anyhow, and part of being a testing entity is you need to file a CLIA waiver. I know in New York, they have a separate system called CLEP. We can help you navigate through that, identify which tests to use, establish your schedule of testing, identify testing space, all the protocols that are necessary, and the messaging that you would want to be sending off to your families and follow up. So here's just an example of one of the testing protocols, quarantine ahead of time, the pre-camp screening tests, asking, the staff and the campers to be tested ahead of time. And of course, that rapid test on the first day of camp, because you really want to make sure no one enters your camp who is positive, because you don't want to have to deal with quarantine on the first day of camp. So having that entrance screen test is really, really important. That's the one thing I would say to take home from this. For camp sessions that last more than a week, as the CDC mentioned, another test 3 to 5 days after arrival. Again, we would recommend a rapid test so that you immediately get those results. You see that high viral load if it's there, and you can isolate that individual contact trace. So I'm happy to answer questions. Essentially, we're here to be there for you. This is just some information about CLIA, but all the data we're happy to share. Anything that I can answer in the next few minutes. I don't know how much time we still have.
Sure. Hi. Just so everybody knows, Phoebe and all her colleagues are everybody's wonderful, but call me a New York skeptic. But I was like, what do you want from this? And they're like, we swear nothing. And they really don't. They just want to be, it's super confusing.
Yes.
So we appreciate that. And you, we have about 3 minutes. If anyone has any questions, you can throw it in the chat.
And yeah, and just to give you some background, I've helped set up testing programs here in the Boston area where we don't necessarily have vendors involved. I do think vendors are wonderful to help you if you can afford their help, but often you can do it yourself.
Great. So we have a question. Can you give your information or opinion on rapid PCR tests?
Say this again? I'm sorry.
Rapid PCR tests.
Oh yeah, so yes, some of the rapid PCR tests basically are like the Q tests. They're excellent. They can, they have the FDA approval. They're just really, really expensive. And if you're able to use an antigen test and do it frequently, so you may give up a little bit of that sensitivity of the PCR test. But again, remember that the PCR test is looking for viral RNA, and the viral RNA can be there as a remnant for weeks and weeks after an infection. So if you are infected, you're told not to test for 90 days because that PCR test could turn positive. The key that we think about rapid antigen tests is that you're looking for the viral proteins at a level that there's a high amount of virus that could transmit to others. So those PCR tests are great. They do give you that rapid result, but I don't know if it's really necessary in a screening setting to go to that level.
That's great. That's perfect. I'm actually going to ask Emily's question from earlier of you, since it doesn't need to be specific to a lab. So I think it's perfect. Camps that run session camps. So those would be the camps that run 1 or 2 weeks at a time, but then multiple sessions. So say they run 4 2-week sessions for 8 weeks. How would you recommend they do testing?
So I would definitely do for each individual child who's coming in, the pre-camp testing, the entrance screening testing. And if they're there for 1 or 2 weeks, a test maybe at 4 or 5 days, and then a test at 10 days down the road. So it's still the same protocol. You just stagger in who is coming into the camp.
That's great. That's awesome. How accurate are the rapid tests when campers do not have symptoms?
So a problem with the way that all of this rapid testing has always been approached is saying, is it related to symptoms? And the truth is, the test doesn't care whether you have symptoms or not. It only cares about the virus. So whether you're testing, you're looking for the virus. And as I said, 50% of people who transmit COVID do not have symptoms. These tests are accurate at picking up high viral load, no matter whether you're symptomatic or asymptomatic. And they've been approved for ages 2 and up.
That's great. Okay, Dana, I'm going to get back to your question at the end because it's a little broader and we're at our 10 minutes. So thank you so much, Phoebe. That was great.